Dr. Kansal and team. The patient is 27-year-old Nalli Gravida, came with inability to conceive for 2 years. Her LMP is 28th November 2022, married since 2.5 years. On examination, PS and PV both were normal. On investigations, MRI showed septate uterus with fibromuscular septum, upper 1/3 muscular, lower 2/3 is fibrous. ET on the both sides normal, left and right. Bilateral ovaries normal, cervix and vagina normal with no septation seen. According to the Eshrey classification, it is U2A, partial septate uterus, C0, V0. Rest other infertility workup was normal. Thank you.
Hello, please connect me.
Hello, ma'am.
Yes, ma'am, you are connected, ma'am.
Yeah, thank you. So we have a new Endo-C advanced system from Cooper Surgical. We did vaginoscopic approach. This is basically to see rather than do. So this is a complete septum which we were thinking is incomplete because if she's got single cervix but the septum is right up to the internal os. You can see the beautiful septum. Is the external camera on this Endo-C system? So we are going on the right side. Okay, and we withdraw and go on the left side, and then we will continue with our regular septal resection. So this is basically to diagnose very well, and probably they have some working elements also. The advantage of this is it's a very soft tip which glides into the cervical canal without damaging. You can see there is no bleeding or anything without damaging any endometrium. We'll just show you the externally the system which we have. So here we come out, this was vaginoscopic. So this is out of cervix and the vagina. Please, external camera here, पानी बंद कर दो brother. ये देखिए ये, आप आ जाओ कूपर सर्जिकल से जो है. So this is where we see and we can take photograph and the video also. You can see how soft is this, flexible, and it's got a nice soft curve. But the only problem is it lasts only for an hour, so you can't do more than one case, or hurriedly you can take a second case, that's it. So thank you Cooper Surgical for demonstrating this apparatus. You can take it and we will continue. You can continue with the other OT. We've done the diagnostic lab in this patient, nothing much. She is an infertility case, and now we continue with the resection. Hello? Yeah, what is the cost? Cost? 4.5 lakhs for the whole assembly, and the probe costs 12,500 for the probe each time you do a new case. So it is little expensive, so it's only for the high-fi patients that you can use it. Only for IVF centers, not for centers like mine, where we are thoroughly gynae OTs.
Ma'am, why we are doing it pre-menstrually, like we could have done it post-menstrually?
Is it premenstrual?
Yeah, it's like the 28th
yeah, you know, the patient came for workshop late, but she's not exactly premenstrual. We've given her progesterone.
Okay.
So that, you know, she doesn't conceive and her endometrium is thin, and that's all, because, you know, you cannot have ideal things always. So she will have an okay endometrium. That's what I believe. पकड़ो नहीं, यहाँ से पकड़ेगी, वहाँ से ब्लॉक होगा मुझे. You can go to the other theater and you can watch us, no problem. Yeah, am I connected?
Yes, ma'am.
Yeah, so you can see it was a long septum and we have very nicely started doing the resection. थोड़ा सा वो आउट कर दो, आउटफ्लो एक सेकंड खोलो सो दैट हाँ क्लोज इमीडिएटली. पूजा तुमने खोलना है.
Ma'am, you're using
बस, बस.
saline as a detention medium?
Yeah, because we are using plain scissors.
Scissors,
Yeah,
yes.
a little hazy. No problem, we will just continue rather than stopping. Right, so usually this is a fibrosed part and we can do without any energy source. And the landmarks are the ostia and we continue till we see both the ostia and in a panoramic vision. So the right side is coming up nicely. So you have to keep in the middle and make small bites. Now we can start seeing the pink tissue. So we will wait. So this is the right ostium, correct? Short and rewarding procedure for the patient.
Yes.
So I try to take small cases myself so that we can manage the workshop for the rest of the faculty. I hope everybody is satisfied with the dissection.
Beautiful dissection, ma'am.
Thank you so much.
It's beautiful.
And so that is the right ostium. And we are almost done now.
Hello, ma'am.
Yeah,
Ma'am, transmission is not very clear.
okay. Audio visual, please see. No, see, if I go a little behind, then you can see better.
Yeah, it is better now,
Correct,
ma'am.
yeah.
It
So
is
when I
magnified.
go close, it goes little off focus. उनका ठीक है, इतना खराब नहीं है
अच्छा है.
ट्रांसमिशन.
जी मैम.
जी.
Like we couldn't see ostia.
Yeah, so I'll just turn my cable and try and show you ostium. This is the right one, okay?
Good one, yes, ma'am.
And left side is little hidden in these adhesions.
Yeah.
So we don't know what these adhesions are.
We can set a biopsy to rule out tuberculosis also, ma'am.
Yeah, we will be doing a DNC. Yeah. I think this should be place of ostium probably.
Yes.
May or may not be. Or maybe the ostium is at this level.
Yeah,
Yeah,
actually.
so that is the ostium.
Yes.
And this was part of the septum only. So we should not overdo the thing. We may leave about half a centimeter to 1 centimeter septum behind rather than over correcting it. So you see the only anatomical landmarks is ostium.
Ostium.
See, initially we thought it is done, but when we make small cuts, we keep on going deeper and in the right plane. I think now it's good. प्रेशर को क्या हुआ ब्रदर, क्यों नहीं दिख रहा है अभी ठीक? पानी इज देयर? We are using Endomet. Yeah, I think now the cavity looks good. Both the ostia are seen.
Yes, adequate now.
So I think, yeah, it's adequate. Thank you so much, because we should not go too much over here. We can see all the pink tissue. So we will just finish with the diagnostic lab and that's it. Thank you so much. You can shift the audio to the other OT.
Thank you. ma'am.
Okay, bye-bye.